Hello, my name is Leon Kimathi. I'm a registered nurse working at Segera Mission.
Hi, Leon.
Hi, Amy.
So, tell me a little bit about the dispensary.
Okay, the name of our dispensary, okay, I'll start from the beginning. We go by the name Segera Mission Dispensary. We are located between Nanyuki town, that is the commercial center of Laikipia County, and Nyahururu. We serve patients in this area, totaling to a population of around 17,000. And we attend to all sorts of cases that seek our services.
For example?
For example, we treat everything from waterborne diseases, which are very common in this area, to respiratory tract infections, pneumonia, and tuberculosis, HIV and AIDS. People living with the condition are also able to get assisted here through our comprehensive care clinic. We do conduct deliveries. We do have several programs that we have with us at the clinic. For example, the child welfare clinic, that is the clinic that caters for children under 5. That's a vulnerable group of it's a vulnerable population. And then we have the malnutrition program, still caters for children under the 5 years of age. And we also have the HIV and TB program as well. Those are programs separate, catering to a specific population in the community. Yeah. Oh, and as well, we also conduct deliveries. Yes.
So, of all of the diseases that you deal with in the clinic, what do you see most often?
Most often, water-related conditions like amoeba and giardia.
I'm sorry, what was that?
Giardiasis. Giardia. It's a protozoal infection, almost similar to amoebiosis, but more serious. And then second to that are respiratory tract infections. Yes.
And how often would you say that you guys deliver babies?
On a busy month, we have around 15 to 20 deliveries on a very busy month, but the average number totals to around 10 to 15 on a fairly busy month.
So some months you have more delivery, like consistently. Say April is always a month where you have a lot of deliveries.
Yes.
Why is that?
Well, that is a research that we've thought of carrying out in the future, but we are still looking in. It's a paradox, actually. Nobody can really relate as to why we have the highest number of deliveries occurring in the months of April and October. But it's something that we want to consider as a research topic.
Sure.
In the coming days. Yeah. But yes, there are months when we have a lot of deliveries, and then there are other months that you even have less than 10. Yeah. We do have a program with the formerly known as the traditional birth attendants of this area. We want to move away from home deliveries to facilities deliveries, that is, deliveries conducted by a skilled health worker. So we talked to the former traditional birth attendants and taught them, encouraged them actually to refer mothers in labor to come for delivery here at the mission. And for the mothers who've not yet started their antenatal clinic.
What is the antenatal clinic? Sorry to interrupt.
Okay, this is a clinic that specifically caters to pregnant mothers. Any pregnant lady before delivery is considered an antenatal client.
Sure.
So anybody who is pregnant and has not yet started or enrolled for care at the clinic, it's the responsibility of these former TBAs to encourage them to start the clinics as early as they can. And when they are due for delivery, they also encourage them to come for delivery so as to prevent complications, for example, bleeding and stuff that normally happens when they have home deliveries.
When you say home deliveries, can you describe the environment that entails?
That's whereby a lady in labor is helped during delivery by somebody who's thought to know or has some know-how, some skill on how to conduct a delivery. But the environment I would describe is not the sanitary one that's required for a baby to be born in. And there are a lot of things that, for example, infections that this baby and mother are both exposed to, and a lot of unforeseen complications or problems that could arise because there are medications that the mother is given to prevent bleeding that obviously they're not given when the delivery occurs back at home. For example, clamping and cutting of the umbilical cord, that one is done using unhygienic instruments and equipment, unsterilized razor blades and unsterilized clamp cords. So you get a lot of exposure. These children, these babies, infants, get exposed to infections as opposed to an infant born in a health facility.
So,
And another thing maybe, there are a lot of risks involved because measures that are normally undertaken to prevent infection. For example, if, for example, the mother has an infection, for example, HIV, the person assisting her during delivery doesn't have equipments like gloves, so they expose themselves to infection and vice versa. Yes.
so when somebody has a baby at home, what do those homes look like?
The community that lives around live in semi-permanent structured houses. That is houses that have been built using cow dung and mud. So inside the houses you find that there's really not much. People, for example, if it's a bed, you find that there are no beddings that you'd find in a different setting. For example, they would sleep on skins, and at times you also find they live with livestock inside these structures or the houses. So a mother could be having her baby on one side of the room and there are goats and sheep on this other side of the room, which is really not the proper or rather the ideal way of, the ideal environment of having your baby or a mother getting helped during delivery. Yeah. So it's not, I wouldn't call it, yeah, it's very unsafe and unhygienic.
What you mentioned dealing with, it's better to deal with some of the complications here. What would be an example of a complication with a woman delivering?
Okay, there are many complications that could arise. For example, on the mother's side, she could develop maternal distress. She could start, like pushing the baby way early before its time, and thus this will make her exhaust her energy and as well result to fetal distress. That is, the baby will come out very tired and probably not. If the distress was too much, the baby could end up dying. So if this happens at a health facility level, it's a problem that could be tackled and could be early identified through several interventions that will be put in place. That is one complication. Another possible complication is bleeding. The mother before or after delivery, especially during delivery, we call it postpartum bleeding. If that happens at home, the risks of this mother dying are very high, because if there are any retained products of conception that, if identified at the health facility, are normally taken care of, bleeding occurs very fast, and the mother can just lose her life in a matter of 15 minutes because of the profuse bleeding. So when this happens at the hospital or at the health facility level, of course there are measures that are taken to stop this, or in case the clinician has difficulty in...
Sorry, the motorcycle's going by. Okay, go ahead. Sorry.
So in case the clinician has difficulty in tackling this, there's also the possibility of referring this mother to a facility that is more equipped in dealing with the situation. Another complication is that the baby might come out tired and needs resuscitation. If this happens at home, there is basically zero help that this infant will get, again, compared to what would happen in the health facility. Yes, so the mother and the infant have everything to gain and nothing to lose if the delivery occurs at the health facility as opposed to home deliveries. Yeah.
What kind of complications occur during a delivery when a woman has been circumcised?
One of the complications I might mention is something we call inadequate pathway. That is because of the mutilation, the anatomy, the woman's anatomy has been messed up with. And so the scars which occurred after the procedure took place, or the mutilation took place, prevent the natural process of birth. And so when it comes to delivery, you find this lady is not able to push out her infant, and the infant, if not pushed out in time or when it's supposed to, will result in fetal distress, or the baby will come out asphyxiated. Asphyxiated means the baby will come out almost flat. All the vital signs will be very, very low. For example, the heart rate and the breathing. And again, this lady will be, the clinician will be forced to perform a procedure to help the lady push out the infant. And such a procedure is termed as episiotomy. This is where the clinician makes a cut on the lady's genitalia so that there's adequate space for the baby to pass through. Because you find with female genital mutilation, the scars prevent elasticity of the muscles around the orifice. And as well, during the procedure, there are communities that normally suture up the orifice. So if the orifice has been sutured, it means during when it's supposed to dilate, during when the baby is coming out, that won't happen. And then the clinician is thus forced to make a cut. And it's really uncomfortable, but fortunately with science we are able to do it in a way that the mother won't endure pain during cutting, during delivery, and during suturing of the incision. Yes, but it's very unfortunate.
How often do you see that? How often do you see FGM?
If I may be permitted to mention a specific community, for example, the Maasai is For every 10 deliveries we get from the Maasai community, at least 8 have been circumcised. Yes. Now you find that the new generation that we have, because of awareness and exposure to information, you find that majority are not undergoing the ritual. And for those ones, for the older generation, you find almost every delivery you get, the lady underwent the the ritual. But with the new generation, it's something that is sort of fading off. Yeah.
That's a good thing.
And that's a good thing, because we always try and provide health education and create awareness on the dangers of female genital mutilation. Yeah.
Do you know why they do that?
They normally consider it a rite of passage.
Oh, like coming of age?
Yes, coming of age, transition from girl, from being a girl to womanhood. Just the same as when boys are circumcised, from boyhood to being a man now. So it's a rite of passage.
Except for when boys get circumcised, it doesn't cause the same complications.
Sure, but they are yet to understand the insignificance of the whole thing, as compared to boys, where there are health benefits that come along with circumcision.
Right. What would you, if you could give me just a ballpark figure, the youngest girl you've had in for delivery? Because last week I was in there, maybe not last week, a couple weeks ago, I was helping with a delivery and the girl was 14. So what would you say would be the youngest that you've seen in there delivering?
14 years of age as well. The youngest I've ever encountered. 14 years of age. And this ended up as a complication. The case complicated and we had to refer to Nanyuki, because this girl's body had not yet fully formed to, she was able to go carry the pregnancy to term, but the process of labor and delivery, she wasn't able to do so. And it's very unfortunate, because the baby passed away, the infant passed away in Nanyuki.
I didn't know that.
Yes.
I was told that she was okay.
There have been several cases. Yeah. So the one that I encountered, during referral, the fetus was alive, but on the way to Nanyuki, it died in utero. So yeah, it was really sad, because this girl rather, went home without her baby. And it was because of the whole thing of having been too young to go through the whole 9 months and then having to undergo delivery.
This was avoidable.
It was avoidable for sure, because instead of this girl being a mother at that age in her life, she would have been in school, where she would be getting her education instead of being married off to somebody, the age of her father. And I feel that if it's something that could have been avoided, and I know maybe it might unfortunately happen to other girls out there, but we believe with time and with the introduction of education in this community, it will be a thing of the past in the coming years. Yes.
That would be great.
Very great.